Hello everyone, my name is Dr. Ominda, and in this lecture series I'm going to discuss the anatomy of the pharynx. The pharynx is in the midline of the neck, so it's a midline neck structure that runs from the skull, the base of the skull, to the esophagus. From the base of the skull to esophagus. So you can appreciate here superior constrictor muscle, the middle constrictor, and the inferior constrictor muscle. Okay, so it's usually located in front of the 6 superior cervical vertebra. Okay, in front of the 6 superior cervical vertebra, and it's 15 centimeters. Remember, we have 7 cervical vertebrae, so the first 6 cervical vertebra anterior to them, that's where you find the pharynx. So from the skull, then it continues downwards as the esophagus at the lower border of cricoid cartilage. So, the pharynx is divided into 3 parts. You have the oropharynx, the nasopharynx that communicates with the nasal cavity, so that's the first part. Then oropharynx that communicates with the oral cavity, so this is oropharynx, and this is the laryngopharynx. So the nasopharynx, oropharynx, and laryngopharynx. So those are the 3 parts of the pharynx. Laryngopharynx is posterior to the larynx, oropharynx is posterior to the oral cavity, and nasopharynx is posterior to the nasal cavity. And so, all of the pharynx is made up of 4 layers. The most superficial is the mucous membrane layer, followed by the pharyngeal aponeurosis, then the muscular layer, and the buccopharyngeal fascia. So when you're asked to describe the anatomy of the pharynx, you state the extents, you go to the 3 parts, then you describe the wall. So the wall has 4 layers. So the mucous membrane layer has stratified squamous epithelium, except in the nasopharynx, where you have the pseudostratified columnar epithelium with goblet cells. So mucous membrane of the pharynx is stratified squamous epithelium, except in the nasopharynx, where you have the pseudostratified columnar with goblet, just like the epithelium in the nasal cavity. Then the next layer is the pharyngeal aponeurosis. It's made up of loose connective tissue that contains lymphoid aggregates. So loose connective tissue with lymphoid aggregates, so that's where you have your Waldeyer's ring. Waldeyer's ring is a collection of lymphoid follicles around the opening of the oral cavity. So towards the nasal aspects, you have your adenoid tonsil. At the tongue, you have the lingual tonsils. At the sides, you have your tubal and pharyngeal tonsils. So those 4 form the Waldeyer's ring. So you need to go to the internet and look at Waldeyer's ring and see the arrangement of these structures. The adenoid tonsils posteriorly, tubal tonsils posterolaterally, pharyngeal tonsils, palatine tonsils anterolaterally, and the lingual tonsils anteriorly. After the pharyngeal aponeurosis, you have the muscular layer where you have 3 muscles which are skeletal muscles. So you have superior, middle, and inferior constrictor muscles. Okay, so this runs circumferentially. Then lastly, you have the buccopharyngeal fascia. So what is the Waldeyer's ring? So this is what I was trying to describe. It's a group of lymphoid tissue at the pharyngeal aponeurosis. So they form what you call the tonsil. So at the back, you have the nasopharyngeal tonsils, which you call the adenoid tonsils. Then you have palatine tonsils that lie in the palatine bed made up of palatoglossus anteriorly and palatopharyngeus posteriorly. So these are the palatine tonsils. And then at the tongue, you have lingual tonsils in the posterior third of the tongue. So these form what you call the Waldeyer's ring. Okay, we also have tubal tonsils around the eustachian tube at the side here. Okay, so the nasopharynx. Okay, this is nasopharynx, oropharynx, and laryngopharynx. So the nasopharynx is located here. Then the oropharynx, you can see the uvula here. So this area here is the oropharynx, and this is the laryngopharynx. This is the larynx. This is the epiglottis here. Nasopharynx communicates anteriorly with the nasal cavity and inferiorly with the oropharynx. Then the oropharynx communicates anteriorly with the oral cavity, superiorly with the nasopharynx, inferiorly with the laryngopharynx. And the laryngopharynx communicates anteriorly with the larynx, inferiorly with the esophagus, and superiorly with the oropharynx. So, the nasopharynx is located behind the nasal cavity, as we have said, and it extends from the skull base to the soft palate. So the roof of the nasopharynx is the skull base, and superiorly is the skull base, and inferiorly to the soft palate. And the nasopharynx is located behind the nasal cavity. So it's separated from the nasal cavity by what we call the choana. Choana is the posterior opening of the nasal cavity into the nasopharynx. So we have what you call the nasopharyngeal tonsils at the roof of the nasopharynx. They're also called the adenoid tonsils. The pharyngeal opening of the eustachian tube lies on the lateral wall of the nasopharynx. Remember, eustachian tube is what connects the nasopharynx to the middle ear. So this is the opening of the eustachian tube at the nasopharynx. So we call it the pharyngeal opening of the eustachian tube. It's on the lateral wall of the nasopharynx. So when they ask you discuss the gross anatomy of the nasopharynx, it's the first portion of the pharynx that extends from the skull base superiorly to the soft palate inferiorly, and it contains the nasopharyngeal tonsil on its roof, and on the lateral wall there is the pharyngeal opening of the eustachian tube. It communicates anteriorly with the nasal cavity through the choana, and inferiorly communicates with the oropharynx. So then we discuss the oropharynx. The oropharynx is the second portion of the pharynx that's behind the oral cavity, and it's located in front of the second and the third cervical vertebra. The nasopharynx is in front of the first cervical vertebra. Oropharynx is in front of the second and third cervical vertebra. What are the extents of the oropharynx? It's from the soft palate, okay, to the tip of the epiglottis. So it's from the soft palate to the tip of the epiglottis inferiorly, and it communicates with the oral cavity anteriorly, with the nasopharynx superiorly, and with the hypopharynx or laryngopharynx inferiorly. The palatine tonsils usually lie in the oropharynx, okay, between the anterior and posterior pillars. So what forms the anterior and posterior pillars? Remember, palatine tonsils are in the oropharynx, and they lie laterally between the palatoglossus anteriorly and palatopharyngeus muscle posteriorly. So these are the structures that form the palatine bed. Palatoglossus anteriorly and palatopharyngeus posteriorly. Again, this just shows you the palatine tonsils and anterior pillar formed by palatoglossus muscle, and posterior pillar here formed by palatopharyngeus. So the tonsil lies between these two pillars. Then we go to the laryngopharynx or the hypopharynx. This is the third portion of the pharynx that's behind the larynx, and it extends from the third to the sixth cervical vertebra. Nasopharynx was in front of first cervical vertebra, oropharynx was in front of second to third, and laryngopharynx is in front of the third to the sixth cervical vertebra. So what are the extents of the laryngopharynx? From the tip of the epiglottis to the lower border of cricoid cartilage, and from there henceforth it continues as esophagus. So remember, nasopharynx from skull base to soft palate. Oropharynx is from soft palate to tip of epiglottis, and hypopharynx is from tip of epiglottis to the lower margin of the cricoid cartilage. That's at the lower border of C6 vertebra, whereby the laryngopharynx will now continue as the esophagus. Communications of the laryngopharynx: anteriorly with the larynx, superiorly with the oropharynx, as you can see in the arrow, and inferiorly with the esophagus. Okay, so this is what you can appreciate. This is your epiglottis here. So this portion here is what we refer to as the hypopharynx. The hypopharynx does not only lie behind the larynx, okay, but it also projects laterally on each side of the larynx. It lies behind the larynx but projects to the side, as you can see from this cross section and from this arrow. So it projects laterally on each side of the larynx. Therefore, it forms what you call the postcricoid region. Postcricoid region, that's behind the larynx, and two piriform fossa on each side of the larynx. So the portion of the laryngopharynx behind the larynx is the postcricoid region, and the one that extends to the sides of the larynx, that's what we call the piriform fossa, and we have two, one on the right and one on the left side. What's the blood supply of the larynx? Sorry, of the pharynx. What you need to understand is that this piriform fossa, okay, they form potential space where foreign body can lodge. So you can have foreign body can lodge in these piriform spaces. So that's a clinical relevance. So what's the blood supply of the pharynx? The pharynx is mainly supplied by branches from the external carotid artery. Okay, so we have tonsillar artery from facial, ascending palatine from facial, and a direct branch, the ascending pharyngeal from external carotid artery. So remember, the external carotid artery, we usually have common carotid from the aorta that divides into external and internal carotid. So external carotid will give lingual, then it gives facial artery. After that, there is the ascending pharyngeal that's also coming upwards, and it terminates by dividing into superficial temporal and maxillary. Now, these branches, lingual artery goes to the tongue, then you have ascending pharyngeal that can give branches to the tongue, branches to the palate, and now we are seeing it giving branches to the pharynx. Facial artery will give tonsillar artery towards the tonsil, also supplying the pharynx and the tongue. Then you have ascending palatine again from facial artery. Then maxillary gives descending palatine. So basically, the pharynx is supplied by external carotid artery through its branches. So facial artery will give tonsillar artery and ascending palatine artery to the pharynx. Then directly from external carotid artery, the ascending pharyngeal artery will give branches to the pharynx. Maxillary artery will give descending palatine artery, and lingual artery will give the dorsal lingual artery to the palate. So those are the 5 arteries that supply the pharynx. What's the lymphatic drainage of the pharynx? The nasopharynx drains into the upper deep cervical lymph nodes. The oropharynx and the hypopharynx also drain into the upper deep cervical lymph nodes directly. So nasopharynx will first drain into the retropharyngeal nodes that will take the lymphatics to the upper deep cervical lymph nodes. Oropharynx and hypopharynx directly drain into the upper deep cervical lymph nodes. What's a motor supply to the pharynx? All muscles of the pharynx are supplied by vagus nerve except talopharyngeus, which is supplied by glossopharyngeal, which is the 9th cranial nerve, and tensor palatini, which is supplied by mandibular division of trigeminal nerve. I repeat, all muscles of the pharynx are supplied by vagus nerve, which is the 10th cranial nerve, except talopharyngeus, which is supplied by glossopharyngeal, and tensor veli palatini supplied by the mandibular division of the trigeminal nerve, which is the 5th cranial nerve. What's the sensory supply to the pharynx? Nasopharynx is supplied by trigeminal, oropharynx by glossopharyngeal, and laryngopharynx is supplied by vagus. So 5, 9, and 10. Nasopharynx, trigeminal, oropharynx, glossopharyngeal, laryngopharynx by vagus. Then we also have sympathetic and parasympathetic branches that give autonomic supply to the pharynx. And the parasympathetic component is from the 7th cranial nerve, which is facial nerve. Sympathetic is from the sympathetic chain ganglia. Parasympathetic is from the facial nerve. So that's it about the pharynx. So when you're asked to discuss the anatomy of the pharynx, you state the extent, the 3 parts, the extent of the 3 parts, the communications of each of the 3 parts, and then you have to state the walls, okay, from the mucous membrane, the aponeurosis, the muscles, and the buccopharyngeal fascia. And after that, you state the blood supply. You list all the 5 arteries that supply it and their sources. Never just mention an artery. You have to mention the artery and the source, then describe the